This is Dr. Andrew Lovy from the Paley Institute. We're here at West Boca Medical Center where we've got a complex case here today. Come on with us, let's see how this goes. This is a 56-year-old female who previously had a release of her ulnar nerve, which is the nerve in the back of the elbow here. She had a release done for symptoms of numbness and tingling in her hand. And unfortunately, after that first surgery, she had ongoing symptoms and even some worsening symptoms. So now we've got to go back in and release this nerve once again. But instead of just leaving it in the back of the elbow, we're going to do something called an anterior transposition, where we're going to move the nerve from the back of the elbow up to the front of the elbow. And that removes more pressure on the nerve for when we bend the elbow, because otherwise it gets draped behind the back of the elbow here. So by moving it to the front, we're going to get a lot more decompression on this nerve. And then we're also going to do something to stabilize the nerve in the front called a adipofascial flap, where we're going to be able to wrap the nerve around with her native fat, which provides a nice, smooth, gliding, healthy vascular bed to try and prevent any additional sites of compression and irritation down the road.